Okay, hello Laura. It's Dr. Bucher. We're just getting started on your right knee. We're looking in the medial compartment. Hold on. And what I wanted to show you here is this kind of tear you have, which if you have to have a tear, this is the one to have. It's way in the back here. See, if you watch this probe, see how it has a little curve to it? Well, normally, let me show you over here. Normally that probe tip doesn't disappear as we go back because things are attached. But as you get in the back here, watch what happens to the probe tip as I turn up. See how it disappears? And then I tug. Now, it's not very unstable, but we know that it covers a good centimeter of the meniscus that it's torn. We've already done some things to kind of roughen it up a little bit. And now we're going to place some implants to secure it, basically just like that. Hold the camera there, please, and hold it level. That's perfect. Okay, and so now we're going to take you'll see a black-looking tube come in. There it is there. It's already been pre-cut to the proper depth. And let me see. And now that we have that tube in, we're going to push a device through it. We'll show you as soon as we get that device out of the tube there. Okay, so we've got a device in. Let me just show you. See, it's got a little rope attached to it, and then it actually deploys an implant behind the meniscus. Then our next step is we're going to create kind of a vertical mattress stitch here. And so we're going to go in right over here. And we're going to push down. All the way through until we have our guide down. Just like that. And then we're going to spin twice. So there's one revolution and then a second revolution. And then we're going to set the trigger. We're going to deploy. And now we're going to pull back out. Okay, and now the next step is we're going to ratchet that down, which is going to tighten things up for us. And we'll just finish this and show you some more in just a minute. You can see how that snugs things down now. Pause, please. Okay, so we've got 3 implants in. That gives us 2 continuous sutures holding down that posterior horn. You can just get they're white, so it's a little bit hard to see, but you can just get a glimpse of them there. Back to the left here. So we're going to finish that. We're going to look at the rest of the knee here. This is a structure called the ligamentum that we release a lot of times just so we can see the nice, pretty anterior cruciate ligament behind it. That looks great. Okay? And then as we look over in the lateral compartment, just drop the leg against the table for me. We're going to push the leg against the table here. And I guess you better do it. So we will slowly raise the knee up and look in the lateral compartment, and this looks pretty good, which is what we expected based on your MRI scan. That meniscus and the cartilage here looks like it's in pretty good shape. We'll go ahead and look at the patella next. We'll go off on the video for just a minute. Pause, please. Okay, so now we're looking at the patellofemoral joint, and this is good news. The patella, or your kneecap, is up above. The trochlea down below here. This is the little groove that the kneecap slides in. And this is in good shape. We can follow this down to the front of the knee, all the way down here, and that looks good. So I think we're done. We're going to finish up and get you back to the recovery room shortly, okay? So good luck to you now. Bye-bye.